Antidepressants increasing the likelihood of getting dementia. Yes, that is what the newest research is saying. This isn't the first time research has suggested that antidepressants can increase dementia risk. Now, when we look at the research, it was primarily what's called SSRI. So these are the most common antidepressants people are prescribed: escitalopram, Zoloft, Prozac, and others like that. Whereas on the other end, SNRIs like Cymbalta and those were not associated with the same increased likelihood of dementia. Now, some medical doctors were quick to say, like, oh, well, we need to do more research again and again and again. That's kind of always what they say when medications don't go the way they would like. But let's step back and take a critical eye on this. Because one, the medical doctors who came to the defense, they are right. If someone does have depression, their rate of dementia is higher in general. So is it fair to completely blame the med? Well, I say yes, and here's why. It's because medications, unfortunately, in today's world, they're being prescribed as a band-aid and not covering the real cause, right? So if we look at depression in and of itself, it is a scientifically meaningless diagnosis. So another researcher used that phrase. I absolutely love it because it doesn't really tell us anything, right? We know that depression at its core, it is a neuroinflammatory based issue. It's also a connectivity neuroplasticity based issue in the brain, but it doesn't tell us why it's actually there. For some people, it's related to their environment. For others, it's related to their food choices. Others, it's related to blood sugar, insulin. It's related to hormones, testosterone, estrogen, progesterone. Others, it can be related to, well, right, past head injuries, gut health, and the list goes on and on. So the reason why depression is a scientifically meaningless diagnosis is there's no one thing that causes it. And this is also why trying to use an antidepressant is, in my opinion, it's bad medicine, right? It is bad medicine. It does nothing to seek to understand why these individuals are dealing with it. Now, if it's a, hey, you know what, we need this short term if someone's in a bad spot while they're working through factors contributing to depression, I'm actually all for that. I think that could be a great solution for individuals. But the whole thing, we're going to put people on antidepressants for the better part of their lives, which happens to many, many people. They're on them for 50, 60 years, and no one is really doing the deeper work to make sure that we're addressing the underlying issues driving the neuroinflammatory process and alter neuroplasticity. So what are your thoughts on this? Because at the end of the day, right, dementia is the biggest growing concern that we are facing as a society medically, and there are many things that we can do that's not covering it up with band-aids.